we now speak to OCTA Research Fellow Professor Guido. Good morning, Professor. Thanks for taking our call today.
Yes. Hi. Good morning, Aria.
Now, Professor, you said nationwide case rates may reach up to 8,000 by the end of the month and 18,000 by April. What are the factors that may lead to those projections that you set?
Well, Ria, those projections are made with the assumption that nothing will basically change the reproduction number that we're seeing right now, which is, as you said, it's almost 2. And you're correct. It means that one person on average infects 2 other people. So that is a critical assumption here. What we're saying is that, if we don't do if we don't do anything, we're headed that way. However, we are optimistic that some of the interventions that are being introduced by the local governments, for example, the curfew, which will, I believe, start today, some imposition on bans, ordinances, we believe that these will have an effect in reducing the reproduction number. This is more of a prediction that the reproduction number will be reduced from 1.95 that we're seeing now to about maybe 1.6 or 1.5. That's a bit optimistic, but if that's the case, then we will be able to manage to reduce the number of cases. Instead of 8,000, we may be seeing maybe 7,000 or 6,500 by end of March.
Okay, so the highest daily number of cases recorded last year was 6,725. Does this mean that this new spike in cases will be much worse than what we saw last year?
Ria, this is definitely much worse. The pandemic is progressing much faster. It's spreading much faster, and more people are getting infected more quickly. And that is the nature when we're dealing with a possible variant or even variants. And they infect more people. They're a lot more infectious, and this is the effect that we're seeing. This is, in fact, what we were very afraid of early in the year, even though the trend then was okay. Cases were not increasing. We were just afraid that if a variant was introduced into the community in NCR, this is what we would be seeing. In fact, right now, it's much worse than we initially projected. We thought it would be 5,000 cases by the end of the month, but we have essentially reached that already.
Yeah, unfortunately, it looks like we're going to beat that. So, Professor, what would you say is causing this spike? Is it the new variants? We spoke to DOH Undersecretary Vergara last week. She said the new variants are simply an aggravating factor, and people have been more lax with minimum health protocols. How would you assess the situation? What is causing the spike?
Well, Ria, it's a combination of 3 factors, and you're correct. There's the people becoming more lax, and I think complacency is due in part to the pandemic fatigue. It's due in part to the vaccine rollout. People believe that since we have vaccines already, that the pandemic is over. I think some people actually believe that. The second is that we did ease restrictions, and as we can see, there are a lot more people outdoors now compared to before, compared to, let's say, maybe even last December. So this increased mobility will definitely give the virus more opportunities to infect other people. And then, of course, the third factor, yes, it's correct that we do not know for sure, regarding the prevalence of these variants. So we don't know how widespread they are. And at the minimum, they are an aggravating factor, as the DOH Undersecretary said. But we don't know that for sure. It could be at least an aggravating factor, but it could be driving the spread of this outbreak so far. We feel that way because the speed of or the rate of spread is much faster than we have seen. This is faster than in August. It's faster than the mini spikes we saw last year. So this is unprecedented, and there must be something else that's driving this. And even though most people are still wearing face masks and observing health protocols at some level, there is something else that's driving it, and we feel that it's the variants.
Professor, the World Health Organization on Tuesday said that we're not on the second wave because we haven't even slowed down the first wave. Is this something you agree with?
Well, the perspective on waves, it's more of semantics, and people have different perspectives on waves because it depends on what wave you're looking at. If you go by I think the more general definition, that it's a wave if you have already flattened it to almost zero, zero or almost zero, and then it spikes again. Then if we go by that definition, we could presumably say that we're still on the first wave in NCR. But if we're looking at the ups and downs of the active cases, it may seem like we're on the second wave or even on the third wave now. So it depends on the perspective. And we don't disagree with that. I personally think we're still on the first wave, but if some people argue that it's the second surge or the third wave of infections, then I could not really disagree with them either.
Yeah, well, I guess a spike is a spike, and we need to address it no matter what we're calling it. Professor, with this rise in cases, do you think it's now time for government to reimpose stricter quarantine restrictions on top of curfews and localized lockdowns?
Well, some localized lockdowns are strict already. I believe some localized lockdowns are already at the ECQ level. So right now, I think we still have a little time. We can see if the localized lockdowns will work, if it will slow down the rate of the spread of the pandemic this week, and decrease the reproduction number. I think that could give us some hope. But if things don't change much soon, if the trends do not change, I think the government will not have a lot of options left, because if we're going to be reaching 8,000 cases by the end of the month, and we're hoping we don't. We're hoping we reach something like 7,000 or 6,500 and slow down the pandemic just a little bit. But if we're reaching 8,000 or even more, and the more is possible, definitely the government will probably step in and impose a more strict quarantine because the healthcare system will be overwhelmed by that point.
Yeah, certainly nobody wants that. We always appreciate your expertise here, Professor David, but in this case, we actually hope that your predictions are wrong. Thank you so much for spending part of your morning with us. That was OCTA Research Fellow Professor Guido David.